Hi, Cassandra.
Hi, Dr. Sara.
How are you?
I'm great. How are you?
I'm doing well, thank you. Thanks for joining me on the Whole Tooth podcast.
There's such a cute title.
Thank you. I appreciate it. I wanted to start off by having you tell us a little bit about yourself.
Yeah, so my name is Cassandra Haddad. I'm a family nurse practitioner at Turnpaugh Health, and I'm the mother to 9.5-year-old twins.
Tell me a little bit about your path into nursing and medicine.
Yeah, so I started out in a very traditional path from a very traditional family. My mom was actually a nurse at the state psychiatric hospital for 25 years, and I grew up very much as part of traditional medicine. And then I decided to be a midwife, which is why I originally went to nursing school. And then I worked in labor and delivery and realized that was not my path. But I was already in nursing school, so I finished out and actually worked in the emergency room. And then I taught nursing school LPNs and then associate and bachelor degree RNs. And while I was teaching, they said, well, you kind of have to have your master's degree. So I went back to school to become a nurse practitioner and worked in traditional medicine, and then eventually ended up at Turnpaugh.
I want to kind of bridge the gap between the traditional experience that you had in Turnpaugh, because myself, I had a very traditional sort of background and training, and then I'm here as a holistic dentist. So it was an interesting path for me, and I'm sure your path was interesting as well. Can you kind of share what sparked sort of your desire to go down a more natural-minded path?
Yeah, so one of my very best friends had her fourth baby, and when she was born, she immediately had severe complications. And it turned out she had something called FPIES, which is food protein intolerance and the enterocolitis syndrome. So she had terrible GI issues, had a colonoscopy at 1 day old. And so that actually set their family down a path of trying to learn, how can we best take care of this child? And she saw some really great providers who told her she was going to have to do things a little bit differently. So she actually started on that path first, and then we started talking about things like, maybe we should use better cleaning products in our house. So it started with, like so many of us, some really simple things like, do I need this scent in my laundry detergent? Well, if I'm thinking about what I'm cleaning the house with, maybe I should think about the food that I'm eating. And she was allergic to dairy, gluten, and soy. So it really opened my eyes up to the world of gluten. And my husband and I had actually decided that, with as much as we'd read about gluten, we were not going to feed our children gluten. And this was actually before he was diagnosed with celiac disease.
Wow.
So I started to have a change really in my philosophy of how I was going to live my life and how I wanted to raise my children. And I was still working in traditional medicine, family practice, when my kids were born. And because of some of the choices that I made about the health of my family, I started facing increasing pressure from my colleagues about my choices. And it got really uncomfortable. And it got even more uncomfortable when I couldn't have open, honest conversations with my patients when they had some questions about some of the same choices I was facing raising my young family. So at the time, I actually didn't know that there was a name for what I wanted to do. I'd always been interested in maybe some herbs and some other ideas. And as my friend went along her journey and I learned there was a name for this type of medicine, I stumbled upon an ad for Turnpaugh. And at that time, it was through like an agency. And I read the ad and I thought, oh my gosh, this is exactly what I'm looking for. This isn't real. This place doesn't exist. So I kind of thought it was a scam just to get my resume, but I went ahead and sent it in. And that's when I learned that this type of medicine does exist, and it was locally. So back then, they only had one office in Mechanicsburg, and that's pretty far away from where I live, but it was such a unique opportunity. So I started talking with Heather and Chris Turnpaugh, and we actually talked for over a year until I finally got brave enough to leave traditional medicine and enter the world of functional medicine with what was then a little bit of a smaller practice. And I was leaving a big, well-established system to kind of venture into the unknown. And it turned out to be the best decision I could have made for myself and my family's health, because then my husband got diagnosed with celiac, and then just trying to navigate, like, how do I raise my kids and how do I do so in the face of adversity? So to go from an environment where no one agreed with my choices or was even willing to discuss them, to being surrounded by a tribe of people who were raising their children and having their families in very similar ways was just night and day. To be able to go to a colleague's house and not worried about what food was there,
Right.
because I knew there were no dyes, it was all organic, there was no gluten, and my kids were going to have a safe place to have a good time, just really shifted the whole dynamic for my family.
It's really a lot less stress once you find a tribe of like-minded people.
Mm-hmm.
And not to say that we're insular and that we live in a bubble, because we know that we're all, we're in a process of learning and sharing, but it's so nice on the day-to-day to be surrounded by people who think like you do, and you don't feel like you're a crazy person talking about some of the experiences that you've had. There are other people who feel the same way, and it's nice for your kids to grow up in an environment where they aren't going to be pressured or shamed for decisions that they're making as well. It's really top down. So I'm really happy that you found your way to Turnpaugh. And now how many offices are there?
We have 5 offices now. So Mechanicsburg, Richfield, Strasburg, Mannheim, and Enola is our newest one.
That's really exciting. Well,
Yeah,
congratulations, because I know you've been part of the process from the beginning, and just watching Turnpaugh expand and sort of share the knowledge that everyone has gained, the holistic knowledge to the patients. And we're really lucky in this area to have providers like you who are able to kind of drill down to the root cause of some of these issues and not just over medicate everyone.
And it's really exciting to be in this area because we're developing a whole relationship with so many other providers who are like-minded to really build that whole village on so many different levels. So I'm excited that you're here too.
Thank you. I'm really glad to be here. I just can't imagine doing this anywhere else. I just can't. I'm sure that there are other little ecosystems all over and holistic things are taking over, but it's really nice to be a part of this Lancaster family and beyond. So how has your approach to patient care evolved from the traditional days to now being at Turnpaugh, being more holistic minded, when you're talking about whole body care and root cause?
Yeah, so one of my favorite jokes is I could never go back. I don't know what I would do if Turnpaugh were to cease to exist for some reason, which I don't ever envision happening, but I have so much time to spend with my patients. And sometimes people say to me, you spend an hour with your patients and an hour and 15 minutes to follow up on labs, and we often run out of time.
That's not enough.
It's not enough. So when you're oftentimes meeting people who have never had someone listen to their whole story, listen with compassion and empathy, or even attempt to put the pieces together, that's a lot to unpack. And patients deserve someone to really listen and pay attention. I may not be able to fix it. I may not be able to move the needle forward, but I will try, and I will do so with compassion and empathy and with all the knowledge that not just I have, but my team has, to really move someone forward in their health journey. And I so often forget what it was like in traditional medicine, and then every once in a while the universe has a way to remind us. So recently a family member had to go through hospitalization and multi-specialty follow-up and subsequent surgeries, and it was so difficult to navigate. And I'm so very thankful that I was able to be there to navigate that with him, because when you have an elderly person on 13 prescription medications, to have someone go to the family provider with them and be like, hey, we need to do something here. It was a good experience, because not only was I able to advocate for him to get the care that he needed in the manner that he needed, but it reminded me of just how complex the system is. If I have trouble navigating it, how on earth do we expect an 89-year-old man to navigate it? They can't, right? So the system isn't built to be patient-friendly. It isn't built to help the patient move through it. And a lot of the resources that we used to have are gone. So even the social workers and the people who do discharge planning, they don't exist anymore. And when I asked about that, I was told that they kind of went away during COVID and never were brought back in. So it's very, I just can't state the impact enough of having a patient come through and then not just being able to have that time to really spend with them, but we have a nurse navigator team now and a patient navigator team to really help us make sure no one's falling through the cracks. So I can say, if you have any trouble scheduling your MRI, here's my nurse's phone number, her direct line. Call her and we'll make sure this happens. or a referral. So I think really those kind of wraparound services, making space for that patient, and just being really honest and saying, I might not be able to fix this, but I'm here for you every step of the way. Call my nurse, send me a message, we're going to walk through this together.
Being available and being accessible.
Mm-hmm.
I think patients really appreciate that. That's some feedback that I've received too, is just being there for your patients and letting them know that questions will come up.
Mm-hmm.
They may feel lost, but they aren't lost, and that you're there for them to help guide them to the next step, because it is a journey and it's evolving. And as you grow, as Turnpaugh grows, it's really important to make sure that the patients that you have a way forward, and they're not kind of feeling like they're getting left behind. So that's really wonderful.
Yeah, thank you.
Yeah. So we talk a lot about root cause in wellness-minded medicine. What does that mean to you? And can you give me some examples where you've been able to get to the root cause of an issue and have resolution?
Yeah, so to me, root cause is really looking at all of the factors that influence someone's health. So what does their sleep look like? What does their stress look like? Where are they at in their health journey in terms of taking into account not just diet and exercise, but what are their hormones doing? Which is one of my favorite things to talk about and favorite patients to see right now. Like, what are all of these different impacts? And not just in the here and now, but did they have years and years of antibiotics for recurrent ear infections as a kiddo? And then they went to college and they kept getting sick and there was more antibiotics. And now they're 25 and they're still getting sick all the time. And now we have all these gut issues. And oh, by the way, here's some antibodies against their thyroid, because now we're starting to see autoimmune disease. So really trying to take all these pieces and dig into, why is the system not functioning the way that it was intended to function? Because truly any deviation from that is not okay. We normalize a lot of stuff. Gut issues are not normal. Do a lot of people have them? Yes. Period issues, not normal.
Right.
Do a lot of people have them? Yes. But why? Right? And even if we can't pinpoint one cause, there's still things we can do to move things forward, because there's rarely one cause, right? Humans were designed to be incredibly resilient. It's not that one-time exposure to mold that crashed the whole system, right? We have redundancy systems and backup systems. It's our environment and our food and our sleep and our stress. And who knows, maybe EMF and Wi-Fi. There's just so many factors. And we can't fix all of those things, right? Lancaster County is beautiful. Lots of toxins here, right? Not the best air quality because there's so many farms, which is beautiful. But so what do we do to kind of offload the system, offset the things that we can fix? And then there's going to be things that we can fix, but how can we get the body into a better state to handle those drains on the system?
That's excellent. Can we dive into a little bit more of what are some things you mentioned?
Yeah.
Period, pain, cramps that are severe, maybe excessive bleeding, things like that. What are some other things that may seem normal because they're normalized, they're common, but they're not normal actually?
Yeah, irregular cycles, not meant to happen. Gut issues, not meant to happen. If you can identify, like, hey, I went to a barbecue and that food was really good and I had a couple ears of corn and then there were some ribs, right? So something that you have a really good explanation for. But chronic things that have been normalized, my belly always hurts. I'm always exhausted. So my favorite question is, are you more tired than you should be, right? You're a busy mom, you're sleeping 5 hours a night, then I understand you're gonna be tired. But if you're doing all the right things and you're still exhausted, that's not normal. Terrible PMS, not normal. Irregular cycles, not normal. Massive insulin resistance when you eat well and you exercise and you're at a great weight, all these metabolic shifts we see in perimenopause, not normal. So I think there's so many things that we've normalized. Everyone's just kind of like not feeling great and tired and they're like, well, this is the way it is. You exercise, you eat well, and you cannot lose weight. Not normal.
Right.
Yeah.
I totally agree with you. And why do you think some of these things you've listed are chronic? Why do you think chronic disease has become so prevalent?
I think there's a lot of reasons, but I think the number one, and this is the hill that I will die on, especially when I talk to families, is diet. You cannot put junk into the engine and expect a good output. So when we're feeding kids red popsicles and blue slushies and simple processed carbs for dinner, everybody's going to get a pizza here and there. My house, it might be a gluten-free pizza, but real life kicks in. But when that's 80% of your diet or 90% of your diet, and kids aren't sleeping, and they're not outside playing, and they're not getting dirty, they're not taking care of their teeth, when we feed this system of toxins and stress on the body, what do we expect the output to be, right? We get one body. That's it. And so we have to take care of it, set those foundations early, but it's also like never too late to turn things around.
That's right.
Yeah.
Yeah. And it's amazing how resilient the body is, which is good because it can compensate for some of the things that we do. But the problem then is I think we get complacent sometimes and we don't realize until it's too late, until there's a big problem, that we have to maybe correct some things. And women's health has become, I think, a little bit more highlighted in the news. And it's really exciting, an exciting time, because I feel like for so long we were either told mistruths or things that weren't really based on research or things that were outdated. And we're finding out a lot more about women's health and hormones. And what are some things recently that you've come across that you find to be changing lives for the better?
Yeah, hormone replacement therapy, number one. I'd say a good 80% of my practice is now hormones, and I love it. It's where I'm at in my life, so I have so much fun in these appointments, and we talk about everything. We talk about...
That could be its whole own episode.
Really good. It's like my favorite thing. We talk about how it changes your dynamics with your partner, with your children, with your parents, at work. We talk about the physical changes in the body that are normalized. Like the brain fog and the forgetfulness, and everybody thinks all of a sudden that there's something wrong with them. There's not something wrong with you. You're trying to listen to your body, and people are just telling you that's how it is. So I'm really open. I loved my OBGYN, and I allowed myself to be completely gaslit into believing that I was not in full-blown menopause. So I was 36 years old. My twins were born. Over the next couple of years, things were really hard, right? So when the twins were like 3, I would have been 39. My mother was terminally ill with an inherited genetic disease. So my mom died of genetic ALS. That's why I do a ton. Thank you. I do a ton of genetic ALS advocacy because I'm a gene carrier. So this is heavy stuff. So while my twins were 3 and my mother was dying and I was diagnosed as being a gene carrier, I was in full-blown perimenopause. And I went to my doctor that I love and I said, things are not okay. I am not okay. I've never had an irregular period in my life. Things are crazy. And he said, oh, honey, you're so stressed. I love you so much, doctor. You're right. I am so stressed. He said, yeah. I said, okay. So I went home and thought, man, I'm really stressed. But he's right. This is okay. And a couple more months went by and I thought, stuff's getting real crazy now. Like I'm going months with no cycle. And so I messaged him and I said, hey, I know you said I'm too young, but things aren't okay. And he messaged me back again and he said, the average age is 52 and you are now 42, right? So years of symptoms.
Oh, wow.
And if you really want to, we can do some blood work. So he gave me a slip for an FSH, one lab test. I got my period that day and I thought, oh, God bless him. He's right. I'm so stressed. And so then things got even more intense. And I thought, I need to do some blood work on myself. And I ordered a full hormone panel.
Good for
and
you.
My estradiol was 0.
Nothing. Yeah. Oh my gosh.
So as someone at risk for a terminal brain disease, I had promised myself I would never run out of estrogen because of its neuroprotective properties.
Right.
And I ran out of estrogen.
Oh my gosh.
Because I listened to the advice that I was too young. And by then I was completely through menopause. So I immediately got on hormones. And the saddest part of that whole story is the impact on my family from having a mom who was not okay and that no one would help.
Why do you think women in particular are dismissed? This has happened. I've had female healthcare professionals, doctor friends tell me they've been to the ER with severe pain, or they've been to the doctor with questions. Pretty standard. I feel like they're pretty standard questions, and they're pretty okay questions.
Yeah.
And dismissed, and just looked at as if they're drug seeking or they are making things up, and they're not. So why do you think that is?
Yeah, I think there's just so many reasons. I don't think that, I don't believe that the vast majority of traditional medicine professionals have the intent to harm.
Correct.
I truly don't believe that, right? I think this was a busy doc who sees women all day long, and women have gotten labeled as tired, anxious, overwhelmed, while their health and bodies are literally falling apart. Because no one has really studied a lot of these things, right? What does it look like to have testosterone replacement in a postmenopausal woman long term? Nobody knows. What does it look like to have a testosterone level of 40 versus 100? Nobody knows. So what we do is we take the potential risks and we multiply them in our brain for a fear level. This doesn't exist. These are all things we make up. So even now, I have women that I have reversed high blood pressure, I'm not making any promises, have gotten feeling amazing, the quote, best they've ever felt in their lives. They go to their OBGYN, and their OBGYN tells them they should not be on topical hormones. I'm talking regular estradiol patch prescription, total standard of care. They tell them they shouldn't be on it. But I fixed everything, and they feel, quote, the best they've ever been. And that's completely dismissed because I think they're so busy and they're in these big systems. They are in these 10 or 15-minute appointments, and they're not up to date on the current guidelines from traditional medicine. So now we know we treat women in perimenopause. We don't make your hormones go to zero. We don't wait until you're getting recurrent bladder infections. Or, am I allowed to say like a lot of stuff?
Say what you want to say. We'll edit if we need to.
You don't have to wait until your architecture of your vagina changes, right? So people are saying this on our Instagram feed. They're like, what do you mean my parts are going to disappear? They do. But no one ever
talks about it.
No. And no one says like, hey, when you're in your 30s and 40s, be on the lookout for all of this stuff.
These signs.
Right. Everybody says like, oh, hot flashes and night sweats, joint pain, anxiety, brain fog, libido. You don't feel like yourself, right? And that was my cry to my doctor is, I am not okay.
We're so intuitive.
I know.
And then we're gaslit by people to make us stop listening to ourselves. But we're so in tune. I think women inherently are in tune with what's going on. Some of the stuff that we experience is insidious. It kind of creeps in over time, and we may not, it's not like a big announcement, but that's why it's so important to know some of the signs. And I think the hot flashes come later.
So the hot flashes part was super interesting. And I feel like of all people, I should have known better. If anyone should have known better, it should have been me. And I still didn't. So I think advocating for yourself is really hard. I thought I was having food reactions because I never had a drenching hot flash or night sweat. I was like, I even tested myself for allergies to apples because I eat a lot of apples. And I was like, man, I'm kind of red and warm, right? Now, part of that may have been histamine because perimenopause is a high histamine state. But I didn't have any like the really classic signs other than missing my period, which was totally dismissed.
Yeah.
So I think women really need to hear like, hey, you might not get drenching night sweats and hot flashes. You may have some subtle insidious thing that creep in when you're a busy mom or a busy professional.
What are some of those early hormonal imbalance signs that women can look for?
Sleep. So many times I have women come to me and they say, oh no, my sleep is fine. And I say, oh, I don't say, oh honey, you're so stressed. I say, oh honey, wait till I put you on progesterone. And then they come in and they say, oh my gosh, I sleep amazing now. I thought my sleep was good. It was not good. So changes in your sleep, pain, hip pain, right? A lot of times it's like a gluteal tendinopathy, or I don't tolerate my workouts anymore. Or my favorite is, I don't tolerate my stress anymore, right? Like I held everything together for so long and I just can't anymore.
The bandwidth
The bandwidth disappears. because your hormones support your stress.
Right.
And I love this. There's a couple charts I really love, but one is your hormones. Now, if you go through menopause at like, let's say 52, your hormones are tanking in your mid 30s. And so up until a couple years ago, maybe even a year ago, I used to say, I see women at 3 spots in their life: 18 to 20, 35, and 50, like clockwork. I bet 90% of my patients were those ages, other than routine things. Now I know why.
Right.
35, your hormones tank. They start tanking, and nobody warned you. And now all of a sudden, life feels different. It feels very different. And that's when you're squished. You have your parents and your kids, and you're busy.
Nobody talks about that.
Nobody talks about it.
The burden and stress of having to raise a family or deal with personal things or whatever on your end while dealing with ailing, aging family members at the same time. And you are sandwiched in the middle.
You're completely sandwiched. And just the mental load that women carry is huge. Now, I'm also very open about this. I have a stay-at-home husband, which is really, really cool, right? And I often tell my patients, hey, it's easy for me to eat the way I eat because I have a husband who's committed to cooking this way. So shout out to him. But women and moms still carry a different mental load. It doesn't matter if you have a housekeeper or a husband cooking. When a child wakes up in the middle of the night and they don't feel good, you get woken up. And I am so thankful that I have children to wake me up in the middle of the night. But it still happens. Or when a family member has a serious illness, you're the one holding the space for that. The birthdays, the anniversaries, the shoe sizes, the clearing out the closet to make space, the do I have the right size clothes for summer? Did we get the pool pass? I don't care how supportive your partner is. Women have a huge mental load. And you can't measure that, and you can't record it, and you can't account for it.
It's like clearing out the closet. It's like your brain space.
Yeah. You have 100 tabs open.
Exactly.
At all times.
Took the words out of my mouth. Yeah.
So you're squished, and now I'm asking you to pay attention to your body, take the things that you've been told are normal, and make some time to take care of yourself.
Well, it's easier to dismiss it and gaslight yourself.
100%.
Well,
Yes.
I'm fine. I'll just push it off until it's really a problem or until I'm really old.
And oh, by the way, I need you to eat 100 grams of protein, take 5 grams of creatine twice a day, eat 30 grams of fiber, 50 different
I'm writing
vegetables.
all this down.
And then I also need you to do strength training twice a week.
Right. For the bone density?
Yes, it's so
I know.
much.
It's a lot.
It's so much.
It's a full-time job in itself.
It is a full-time job to take care of you.
Right.
So where do women take from? Themselves.
We're not on the list.
We're not on the list.
We're not last. We're not even on it.
You're not on it.
I know. And it's so important for us to take back. If we have of ourselves to give, we have to give to ourselves first, right? So
100%.
that's kind of the lesson in that. And it's feeling selfish and the mom guilt. We were talking about that earlier off camera. It's always there, but it's you're able to give when you are a little selfish to yourself. If we want to think of it that way, I don't like characterizing it that way, but taking time for yourself is so important. And then we did talk about hormones, but what is one other thing about women's health that we don't talk about enough besides the mental load, besides the stress?
Yeah. And besides hormones.
And definitely, that's first.
You know what? Heart disease. So I, work in a rare disease space, but the number one killer of all men, all women, all around the world is heart disease, right? Heart disease doesn't have a glamorous label. It doesn't get a whole lot of attention. I think we have, wear red day. But heart disease is huge, and it's a future state, right? So when you're momming and you're working and you're trying to eat your protein and get your exercise in, that future self kind of disappears. But what you're doing in your 30s and 40s is really setting up your future health. And now we know women's metabolic health and risk for heart disease is hugely impacted by hormones and so many other factors. And it's really confusing right now to try and navigate as a patient the current cholesterol guidelines. Are eggs good or are eggs bad? Is aspirin in or is aspirin out? And what the heck is ApoB and LP(a), right? All these word jumbles. Because, oh, by the way, all that stuff I told you need to do earlier, you now need to know these numbers too. So I think that's truly the biggest risk facing all women is heart disease. So what can we do to reduce your risk of your future health, which is really hard to make time for in the present you?
Right, especially if you're stressed out about so many things. You're not worried about the now, you're definitely not worried about the future.
100%.
Right, so that's an important thing. And maybe at the end, if you give me some resources that you love, I can link them down below.
Oh, sure.
Some charts and things that you had mentioned earlier. We talk about finding healthcare providers that listen, that take time. In my visits, new patient exams are an hour. My office manager wants to wring my neck sometimes because we go over and she's like, we can't shorten these. They have to be an hour. And she's right, because we do so much in that initial visit, including airway analysis, which is thankfully getting more attention now, and spacing. And we talk about the future, like what can you do now to have a better future? Because in pediatrics, we're always thinking about down the line. But how do you know when it's time to change a provider or to seek out maybe a more like-minded provider or dentist?
Yeah, so I would say anytime you just walk out of that door feeling like that wasn't great. And I recently went to an eye doctor and I left so disappointed in that visit. And it was such a humbling experience to be a patient again and think, I just paid a lot of money for a visit that, number one, no one told me wasn't going to be covered in any way. And number two, I was so dissatisfied. And I sat in the parking lot for like 10 minutes. And it's okay, right? Because it wasn't a severe issue. But I just thought, I'm so disappointed. And I tried to communicate to the staff and they weren't really hearing it. So when I got an email to leave a Google review, I actually emailed and said, as a provider, I would want someone to let me know these concerns rather than blasting it on Google. And I went through all of my concerns. And I just think, I'm not going to go back, right? I think it's totally okay to tell someone when you don't have a good experience. And if they're not willing to listen, that's a huge red flag that you shouldn't go back. But if you just leave and you think, meh, that wasn't that great, you finally took the time to prioritize yourself.
I know.
Or your children,
right?
Right? And if you just don't leave with a great feeling, that's your sign to go. Or if you love your provider, but you're just not getting anywhere, do they have a team member they can ask to look at something? Can you see someone else at that office if you love the office? So I think if there's not just a mental frustration or you're just frustrated with the progress, I think those are all signs to see someone else.
How do you know whether the provider that you are seeing is really listening to your concerns and not just giving you sort of a nod and not really taking on board what your concerns are?
Yeah, I mean, there's definitely some tools I use to do that. So the first thing I do before any patient comes back is I look at their new patient paperwork. Patients spend a lot of time. So if you spent time on a portal and you walk in and they say, why are you here? Right? Now, sometimes I'll say, I looked at your paperwork, walk me through this timeline, right? But they should be able to acknowledge some of the history that you've given them and then ask clarifying questions, right? Like, I hear you telling me that you're really tired. Are you more tired than you should be? What does your sleep look like? Are you waking up in the middle of the night? Is someone in bed with you kicking you in the middle of the night because you have little people, right? Is there a cat in the room? So they hear your concern, reflect back to you, and ask clarifying questions to help you kind of navigate and get to the root of the issue.
Right. So establishing a baseline and letting the patient know you've read through their concerns, you acknowledge them, and then going a little deeper.
Going deeper, and then one of my favorite things to talk about, and this was one of my biggest disappointments with that eye doctor experience, what comes next, right? Where do we go from here? Patients are incredibly competent and well-researched. We're in the power of the internet and AI. Patients are more complex than ever before, and they're coming in with really, really good questions, and they've already done a ton of reading. Particularly in a rare disease space, patients are highly educated because they've had to be, because they've had to advocate for themselves.
Correct.
So I think really having someone to not just ask those clarifying questions, but say, hey, listen, we're going to try this, this, and this. I'm going to see you back in 3 months. That feels like kind of a long time, but we're going to get some extra blood work then. But if things are not going well or they're not improving over the next 2 to 3 weeks, I need to hear from you, right? I want a follow-up timeline and a when do I call you? I think just someone really laying out clear action steps is really a key, because then you know they've heard you, they're holding space for your concerns, and they have a plan. You've got to have a plan.
Right, and especially something that's concrete that the patient knows that they won't fall through the cracks. And we do usually 6-month intervals, but I frequently do 3 month or 1 month.
Mm-hmm.
And for bigger, more complex things, a week, like surgeries, a week. Just because you don't want your patients to fall through the cracks. And I'm so happy to hear that you agree with that too. And that's maybe a red flag that some patients can look out for if there seems to be very little follow-up or care or concern for following up with a concern that they had or a diagnosis maybe that was made. Well, what now? What do I do? And I get that question a lot from patients as well. We have really savvy patients in the wellness field. And I think it is because similar to the rare diseases, they've had to advocate for themselves. They've gone through several providers. They've learned what to look for, and they come to you prepared with questions, products. I've had parents pull things out of their pockets or bags. I use this product. What do you think? And it's such a two-way street of learning and sharing information. And it's always encouraging me to learn more. I'm sure you feel the same way.
Oh, I love learning from my patients. They're always turning me on to new products, asking me new things, showing me new research, telling me about a new podcast to follow. I think it's a really fun two-way street.
Absolutely. So let's talk a little bit about some things that we can do to prevent some of the illnesses we talked about that happen downstream. Nutrition and lifestyle we talked about. Why are these in particular so important and part of the counseling that you provide?
Yeah, so I like to talk about, we have modifiable risk factors and unmodifiable risk factors. So I talk about this a lot with heart disease, right? Lp(a) is something that you're born with. It can fluctuate in menopause, but we don't get to choose our genetic deck of cards. And I know this better than anyone else, right? What can we do even when we're handed a bad hand, right? My hand's pretty bad. What can I do now? I can try and decrease my toxin exposure as much as possible. I can eat the best I can. I can build my muscles now to stay strong in the face of a disease that eats your muscles. Stress, I don't like to tell patients to try and manage their stress because it's a fallacy. Right. You can't just manage your stress, particularly with everything going on.
That's a stressful thing to hear.
It's a totally stressful thing. Is there any stressors you can take off your plate or choose not to take on? That's a different conversation. Sometimes there's stuff we can take off the plate, right? Sometimes not. Sometimes there is.
Managing and mitigating, not
100%.
Trying to eliminate. Yeah. It's unrealistic.
Completely. So I think lifestyle and nutrition are two of your biggest modifiable risk factors. Every day you get to choose what you put down the hatch. Not every day is a home dunk. I'm terrible with sports analogies. Slam dunk or home run.
Home run or slam dunk?
Home dunk, right? It's not a home dunk.
I like it.
Yeah, I like it too. So, for example, I was in Philly. There's a great little gluten-free donut shop in Philly.
Is it in, oh gosh,
like
Fairmount?
It's near Passyunk.
Oh, okay.
It's called Okie Dokie Donuts.
There are a couple of them that are out there. Yes.
So it was just such a ride. It's like 6 miles from where I have a clinic in Philly, and it takes like 40 minutes to get there. But I did go on Thursday and got donuts.
Good for you.
Yeah, right? Because my kids don't get donuts, like ever. To find fresh gluten-free donuts is a really rare treat. I 100% ate a donut.
Good for you.
When will I eat a donut again? I have no idea.
The next time you're in Philly.
The next time I'm in Philly, right? So I think, how do you allow for real life, but still make the best changes that you can, right? So am I going to eat a donut today? Nope. I didn't even eat a yogi when you offered one, right?
That's right.
So today I'm going to be really, really good because I wasn't as good as I could have been yesterday. And tomorrow I'm going to try to be really good again. And every day I'm just going to do the best I can while acknowledging I'm a squishy, flawed human, right? So I think if you have a bad deck of cards or stress on your plate that you can't take off, focus on what can you do, right? You can try your best every day to move your body, not bathe yourself in toxins, and eat really well.
Let's talk about 3 specific things that people can do right now to make it a better month for them, health-wise.
Yeah, I would say pick one product to replace.
Okay.
Right? Whether it's your skincare, your makeup, a household cleaner, pick one thing to replace. Or, get a reusable bottle, and please stop walking around with the plastic disposable water bottles. I cringe every time someone comes into my office and sets them on the table. So we know plastics are really, really dangerous. The poor penguins have plastics in their brains, right? The other thing I do is after I spend money for a stainless steel water bottle, I use a stainless steel straw. Now, you do have to be careful with that as well and get the right grade.
What about glass?
I love glass.
We have glass jars at home. Okay.
Yeah, I love glass jars at home. I love the sip spout.
Yeah, it's convenient.
It's so
it's
convenient,
nice because then you're not spilling all.
So how do we mix convenience with health, right? So just pick one thing, swap out a product, whether it's a cleaner, a cup, or a makeup. Add a new vegetable, right? It's so easy to not get your vegetables in a day.
Mm-hmm.
So fiber is the buzzword of 2026 for very good reason. Women, minimum 25 grams of fiber.
What does that look like? What is a 25 gram?
I was going to say, do you know how much 25 grams of fiber?
No.
It's a lot.
Okay.
We're talking 6 servings of vegetables and fruits a day.
Oh, okay.
It's so
Were
much
we
food.
taught that growing up?
No.
Is it 6? Okay.
No. We had that yucky food pyramid with all the bread on the
inverted
bottom.
food.
Yeah, eat all the bread, honey. And then have like 2 or 3 veggies and maybe 2 or 3 fruits. Don't eat too much protein. And for the love of God, don't eat an avocado. Right?
Oh,
no olive oil,
right.
No fats. Right? I hate the food pyramid. I love a food plate. And this is what I teach my patients for weight loss and for diabetes. Half of your plate, non-starchy vegetables.
Okay.
Half your plate.
That's a lot.
That is a lot, right? Quarter your plate, your protein. Have a big piece of protein. Get crazy. Have 6 or 8 ounces of meat. Oh my goodness, right? Grass-fed beef all the way, chicken, fish, whatever you want. And then the only thing I say, like, I really want you to measure is that carb.
Mm-hmm.
Like, can you keep it smaller than a tennis ball?
Yeah. In your palm?
Yeah.
Imagine. Okay.
Yeah. Half a sweet potato. Get crazy. Have a white potato. Just have half. And put a nice healthy fat on there.
Yeah.
So if you really did that for every meal, right? 2, 4, 6 servings of veggies.
There you go.
Yeah. What can you add to your eggs in the morning? And if you can't get it all in, how can you supplement?
Right.
But even a fiber supplement is usually only 6 to 8 grams of fiber a day.
And we need 25.
Minimum 25. Minimum. And guys need 30, right? Show me a guy eating 7 vegetables in a day. They're pretty few and far between. So how can you make sure you're constantly getting these fruits and veggies in? Wash them and cut them and put them in the front of your fridge, right? Anybody who has kids knows this.
Yeah.
They don't move the ketchup. So your veggies and fruits have to be in the front, ready to go. Or when you come home from work and you're ready for a snack. If there's not something ready to go, you're reaching for something that's not so healthy.
Yeah. I love the pre-washed, pre-cut.
Yep.
There's no excuse.
Buy yourself some cute containers.
Yes.
Whatever you got to do, but you got to put them in the front. If they go in the back, they're going to die.
You're never going to see them. They'll shrivel up.
If they're in the container, they're going to die.
Right.
Yeah. So just pick one new thing to try. Make it fun. A star fruit or a dragon fruit or a fennel bulb. Like, let your kids pick out something at the grocery store to try. And if you don't like it, you bought one.
Right.
Pick a different vegetable next week. Just add some piece of produce.
That's right.
Yeah.
That is something that feels very doable. I feel like a lot of us in the holistic, I've talked to so many moms, myself included, we started out with like one product swap.
Yep. That's how it always starts, is one
always
product.
One product swap. And then you go a little crazy and
Yeah.
you're like, what else can I change out of here? Yeah, for me, it was plastic containers and I switched to glass. And then from there, the cleaning products.
Yep.
I'm still switching stuff out.
All the time.
Yeah.
I'm always in pursuit of, if someone knows the right laundry detergent, my husband will be eternally grateful.
Molly's. I don't know. That's what
I
just switched. That's what I just switched.
And I like Molly's. I think we might have their fabric softener, but
Okay.
I'm constantly in pursuit of like the best, cleanest product that we can use. And then I think the third thing is put your phone down and go to bed. Put your phone down.
What about the blue light glasses though?
Oh, no, I don't care about the blue light glasses. Put the phone down and go to bed. You do not need to eat before bed. You are not hungry. You are tired. And this was such a vivid realization. Twins were little, right? And we were on like the crazy, like every 3-hour nursing, supplementing, topping off, pumping schedule. And my husband and I are like zombies standing in the pantry, like eating. And I looked at him and I said, we're not hungry. We're exhausted and we need to go to bed.
Your body needs something.
It needs something. And what it needs is sleep.
Yeah.
So I fall into this trap all the time. By the time we're home from karate and getting the kids settled and it's summer and we crank their palate expanders, it's like 9:30 or 10 o'clock at night, right?
Right.
And then if you want to, like, I don't know, say hello to your spouse or watch the show you've been dying to watch or feed your fish or do anything to take care of yourself.
Right.
Now we're looking at 11 o'clock at night.
For sure.
and then you just want to check social media one more time
Right.
in bed with that light in your eyeballs. So just try and back things up a little bit earlier. Try and get in bed at a reasonable hour, and please don't look at your phone in bed.
I know, does it have to be 5 feet away or in a different room? Baby steps.
Baby steps.
Let's just turn it off
Baby
first.
step. Yeah, first step, turn it off or set yourself a reminder. My phone sings a little lullaby, and I know I got to put it down. That work email can wait. I don't need to play another round of whatever silly game I found. I don't need to see what so-and-so is up to before I go to sleep. Doom scrolling, right? So just go to bed and get some sleep.
That's the best advice. I know. Maybe that's something that I'll begin to incorporate. I feel like the second half of the year is upon us, so it's like, let's renew our New Year's resolutions.
I'm going to start texting you. Are you in bed yet?
And I can't answer.
You can't answer because
like,
your phone's 5 feet away, turned off.
Oops. It was a trick question.
It was a trick question.